Hello, everyone. I'm Commissioner Ope Shirtonwa, and it is my great pleasure to welcome you to MCDHH's 35th anniversary. This is the first of several events where we will be celebrating 35 years of service, training, education, and advocacy in partnership with the Massachusetts Executive Office of Health and Human Services and with all of our community partners. Thank you for being here. I'm now going to turn the program over to Michelle Dardano, our statewide advisory council chair, who has been working with us for the last several years and has been doing an amazing job.
Hello and welcome to MCDHH's 35th anniversary celebration. My name is Michelle Mata Dardano, and I serve as chair of the Statewide Advisory Council, and it's an honor to be here. I know all of you are thrilled to join me in celebrating 35 years of MCDHH. I would like to introduce Statewide Advisory Council Vice Chair Carrie Thompson, who will be sharing MC duties with me. Carrie has been a great advocate and community partner, and we are so happy to have her with us.
Hello, everyone. It is a pleasure to be here celebrating 35 years of MCDHH. We have the great honor of sharing Governor Baker's remarks in recognition of the MCDHH anniversary.
Hi, this is Massachusetts Governor Charlie Baker. Thank you to everyone joining us today as we recognize the 35th anniversary of the Massachusetts Commission for the Deaf and Hard of Hearing. This is an important milestone in the history of our Commonwealth, and it's an honor to celebrate with all of you. I'd like to thank Commission staff, the Statewide Advisory Council, and community stakeholders for your years of service, in many cases decades of service, to the Commonwealth and to all the folks you serve. The Massachusetts Office of Deafness operated under the auspices of the Massachusetts Rehabilitation Commission for many years, until the community successfully advocated for a standalone agency solely focused on deaf and hard of hearing and late deafened individuals. Once established in 1986, MCDHH has been the principal agency for individuals who are deaf, late deafened, and hard of hearing. That's 20% of the population who has some degree of hearing loss. The Commission provides a wide range of services and programs and ensures ADA-compliant access across government, including the courts, law enforcement, public safety, education, and public health. During the COVID-19 pandemic, the Commission launched several tools and provided steadfast support to ensure the community could successfully navigate the public health crisis. I and other elected officials counted on the Commission for continuously staffing our regular press briefings. I'd also like to thank the Commission and the community's active involvement, our multilingual public awareness campaigns, Get Back Mass, and Trust the Facts, Get the Vax, included ASL spots featuring familiar faces from the community. I know we're all breathing a big sigh of relief to see how well these efforts played out, with Massachusetts consistently a leading state on vaccinations. Finally, it's been a pleasure to welcome Commissioner Ope Shirtonwa as the Commission's new leader. Commissioner Ope brings over 20 years of experience as a lawyer, advocate, and accomplished public official who's worked to improve access, accommodations, and quality of life for individuals who are deaf, late deafened, hard of hearing, and deafblind. As we take a moment today to look back on MCDHH's incredible 35-year history, we can also celebrate the exciting work that lies ahead. I want to thank you for 35 years of education services and support to deaf, hard of hearing, and late deafened people here in Massachusetts. Thank you.
We are also honored to hear from EOHHS Secretary Sutters, who shares her good wishes on this wonderful occasion.
Thank you, Governor Baker, Commissioner Opie, Michelle Dardano, and Carrie Thompson, our statewide Advisory Council Chair and Vice Chair, for being with us and leading today's celebration. I'm Mary Lou Sutters, Secretary of Health and Human Services. I am grateful to be with you to mark this special anniversary. This has been an exceptionally difficult year for all of us in so many ways, and I want to thank all of you for your resilience and commitment to one another. Throughout the pandemic, the Commission continued to provide direct services, technical assistance, and communication access to consumers across our state as we have all adjusted to remote and hybrid work while continuing to adapt to our new normal. I also want to acknowledge the very important role that the Commission has had throughout the pandemic, including our mass vaccination sites and in-home vaccination program, ensuring accessibility. Almost every COVID press conference, as well as those for Boston and Springfield city mayors, included interpreters, and our public awareness campaigns featured individuals who were deaf or hard of hearing. You substantially increased vlogs and collaborated with other parts of state government to expand access. The Commission was instrumental in developing an accessible COVID-19 card, an important tool for communication between our healthcare providers and their patients. And we welcomed a new commissioner to guide the way forward, a new beginning with Commissioner Opie. So how important is it to come together for this anniversary? We must be inclusive, and this anniversary provides an opportunity to recommit ourselves to that important principle. Since 1986, the Massachusetts Commission for the Deaf and Hard of Hearing has been supporting residents on behalf of all individuals, their families, affected by hearing loss. The Commission has continued to grow and adapt to the needs of a fast-paced world and changing technology, furthering its mission of supporting access, cultural competence, advocacy, and education. And with an acknowledgement that there is always more to be done. But the results are clear. We're more equitable education opportunities, increased access to the legal and court system, improved safety, public health, and law enforcement practices, and better behavioral health and substance use disorder supports and treatment, specialized case management, and independent living services. And the Commission will continue to grow and innovate. Commissioner Opie and the team are focused on workforce development to increase the number of qualified providers who deliver services to this unique community. So today, we congratulate the Commission and all of you on this important marker and pledge that we build a future together that is even stronger. Thank you, congratulations, and happy anniversary.
Hey, Massachusetts. What do you want to get back to?
I really want to be able to give hugs again.
I want to get back to taking my son to play dates and birthday parties and hanging out with his friends again.
You know what I want to do? I want to get on an airplane and travel all over. I want to go to Hawaii.
I want to get back to partying.
I can't wait until we get back to live theater.
I can't wait to get back together with my friends.
I really want to play basketball again.
I want to get back to hitting up all my favorite restaurants and breweries. It's about time.
I want to go back to Fenway.
We've worked hard, but we're not there yet. So we still need to wear a mask that covers your nose and mouth. Keep our distance at least 6 feet apart. And get tested. It's free and available. We can get back, Mass.
Love you.
Ya.
Bye.
Learn how at mass.gov/getback.
Approximately half of the people in Massachusetts with COVID-19 never feel sick.
Yet they can still spread the virus. What you do affects the lives of others.
Wear a mask, even if it's inconvenient.
You must wear a mask for protection.
Wash your hands, even if they seem clean.
It's really important.
Keep your distance, even if it means not hugging your friends or family.
Avoid groups,
Even if it means visiting your friends and family virtually.
Or use your video phone.
Remember, your actions have consequences. For more information, visit mass.gov/stopcovid19.
Hello. I'm a doctor that works in Western Mass, and I'm hearing.
Hi there. I'm a deaf psychologist and work at 2 hospitals in Central Mass.
Hello. I'm a hearing pediatrician, and I work in the South Central region of Massachusetts.
The COVID vaccine is a critical tool to protect yourself and to end the pandemic.
But you might have questions about its safety.
The COVID vaccine is absolutely safe.
The same safety measures used for all vaccines were followed for the COVID vaccine. tens of thousands participated in vaccine trials to prove it's safe.
Since then, millions of people of different races and ethnicities have gotten vaccinated and only experienced mild side effects.
After the vaccine shot, some people experience redness and pain at the injection site, fever, body aches, fatigue, or headaches. This is normal and usually goes away in 1 to 3 days.
I got the vaccine to protect myself, my family, and my patients. All of us.
I got the vaccine as well.
Me too.
When it's your turn, trust the facts. Get the vax.
I am excited to share the MCDHH award winners for this anniversary celebration. The B.J. Wood Trailblazer Award goes to Ivelisse Ivy Velez. Awarded for her vision, unending dedication, drive, and determination to achieve positive change for the deaf and hard of hearing community.
Thank you. Congratulations, Ivy. Thank you.
The Gail Solop Interpreter Award goes to 2 individuals. Diane Staines and Stephanie Hockelin. These 2 individuals received this award for making significant strides to improve services in the interpreting field and whose work and commitment to the community has been heartfelt, full of volunteership, and whose provision of services is deaf-centered.
Thank you. Thank you. Congratulations, Diane. Thank you. Thank you. Congratulations, Stephanie.
The Lifetime Achievement Award goes to 2 individuals. Terry Malcolm and Concheta Jet Kederetz. For their demonstrated commitment, energy, and effort working on behalf of the deaf and hard of hearing community.
Congratulations, Terry. Thank you. Thank you. Congratulations. Thank you. Thank you all. Congratulations, Jet. We truly appreciate all of you for your services to the community in varied ways, all of your efforts to ensure that deaf and hard of hearing people who live in Massachusetts have the resources they need, the support they need. Thank you all. Thank you. Thank you. Congratulations.
At this time, we would like to present a sign language performance from the Marie Jean Phillip competition at Northeastern University. This is an annual event designed to recognize the creativity and talent of deaf and hard of hearing students. We are excited to present the winners of the storytelling portion of this competition. We are very grateful to Northeastern University for their willingness to share this event with us.
ASL Poetry, ages 8 and under, Diana Robarts, Wisconsin School for the Deaf. Hi, I'm Diana. I'm 8 years old. My ASL poem is entitled Socializing at School. I will use 3 hand shapes, S, B4, and 5. Having fun at school, socializing, mingling, then COVID hits, spreading everywhere, sickness everywhere. All the schools are closed. No more mingling. Everyone must social distance. Faces hidden by masks. School became virtual, bummer. As for socializing at school, oh well, what can you do? ASL Poetry, ages 13 to 18, Michael Small Robinson, Ohio School for the Deaf. Hello, everyone. Life is good with traveling, going to the beach, enjoying food, swimming, diving, good friends, kicking the ball around. Then, out of nowhere, what's this? COVID-19? Quick! Take cover! Try to escape. We can't outrun it. Hurry, don't let it in. Stay locked down. The whole world isolates. Depressed. Bored. At home. But then, what's this? Zoom? On the screen, I see friends. Sign language. A sense of connection. Connection restored. Connection restored. ASL Storytelling, ages 13 to 18, Amagni Konkel Harmon, the Learning Center for the Deaf, Marie Phillips School. The earth spins, days go by. A blind eye is turned, racism swept under the rug, time after time. The earth spins, days go by, socializing, travel, work, school. The earth spins, days go by, the sound of a gunshot, a black man falls, A blind eye is turned, racism swept under the rug. The earth spins, days go by. 2 gunshots ring out. No response. The earth spins, days go by. The pandemic hits the nation, travel is banned, socially distancing enforced. Work ends, school stops, the earth sputters. Days are upended, turmoil at the Capitol. All eyes on the news. The cop kneeling on his neck as we watch in horror, reeling in pain. The death of George Floyd goes viral. We beg for change, for people to see, only to be shut out again. The rug is pulled back, a breakthrough. Together we start to examine a broken system. The start of dismantling racism. We need change to be made, awareness to be spread. Will it change? Are you willing to change? The earth spins.
MCDHH would like to acknowledge the community members and advocates who worked hard to establish an agency solely for deaf, hard of hearing, and late deafened individuals. We will be asking anyone who wants to share a story about the agency's establishment to come forward and tell us how you were involved, or if you remember what was happening at that time. Stay tuned for our message and vlog with information on how to submit your stories.
Hello, everyone. Welcome to the Massachusetts Commission for the Deaf and Hard of Hearing, or MCDHH. My name is Ivy Velez, and I am thrilled to be celebrating the 35th anniversary of MCDHH. This is going to be a year-long celebration that I cannot wait to share with you all. Hello, my name is Edgar Herrera. Where were you in 1985 and 1986? We know that many of you were involved in establishing MCDHH. Do you have any pictures from the past? Perhaps newspaper articles, or maybe you were involved in the task force on deafness. We are looking for any commission-related items or memories. Maybe you were involved in an interview or have some photographs. Please send us any of these. Did you see the MCDHH commissioner on the news? If you have a story to share, you may record a video of yourself and send it to us. Once MCDHH receives all of these items and recordings, they will be saved for historical purposes.
We want to see your recordings, stories, photos, and articles. So please send them to us. You can record yourself, or you can set up an appointment to be recorded remotely through Zoom or another platform. If these options are not convenient for you, you can request someone from MCDHH to come and film you while following COVID safety measures. Terry Malcolm and other MCDHH staff will coordinate this effort. You may reach Terry by video phone at 617-275-4480 as shown below. Or by email at sacmcdhh@gmail.com as shown below.
All this collected information will be added to an MCDHH video library that will be available for everyone. The new recordings and articles you send us will be shared and posted during the year, but it will not be possible to include everything at that time. The library will be a historical resource to celebrate the 35th anniversary and preserve those cherished memories. Thank you.
MCDHH is always looking for community members who are eager to get involved and who would like to serve on the statewide advisory council. If you are interested in serving in this important role, please email Amy Hannigan at ami.hannigan@mass.gov for more information on how you can be a part of the important work that we are doing.
I want to thank all of you for joining us in this exciting event. Special thanks to our MCs, the Anniversary Planning Committee, and to all of you for celebrating our years of service and community support. Take care, and we look forward to seeing you again soon.